Over half of world's population suffers from lack of access to information in their language. Language barriers prevent them from getting vital information and communicating their needs and ideas proactively. In particular, people who are poor, less literate, and come from underserved languages are left without a voice in the development of the places where they live, the future of their families, and in global conversations about important issues such as climate change, women's rights, or health. Minority language speakers are denied opportunities to get the information they need in a language they understand. Do you need a doctor? Boil water for safe drinking. What is your name? Basic phrases can save lives in a humanitarian emergency, yet often communication fails because humanitarian aid workers and the people affected do not speak the same language. Information in the wrong language is not information. What people need most in an emergency can be information in their own language. When disaster strikes, one of the most immediate priorities for both those affected and humanitarian workers trying to support them is giving and receiving information. Yet language barriers frequently complicate response efforts. This is why language professionals play an essential role in the coordination and delivery of humanitarian aid. Translators Without Borders innovates in the world's most vulnerable to get the world's most vulnerable people information that they need and want in a language and format they understand. We specialize in language and effective communications in some of the most difficult contexts. Founded in 2011, TWB has expanded rapidly to meet the growing realization that vital and often life-saving information must be in formats and languages that people can understand. TWB provides people access to vital knowledge in their language by providing aid in humanitarian crisis response through translation, providing translation and plain editing services that are culturally appropriate, accessible, and open source, building language translation capacity at the local level, and raising awareness globally of the language barriers. Many of us who speak major languages like English are finding it easier and easier to navigate the world. When we need them, we have readily available translation apps conveniently located on our phones. But for the people who speak underserved languages, getting information in a format that they can understand and communicating their needs is more than a frustration. It can be a matter of life and death. TWB's research shows that people's comprehension of health information increases by 78% when the information is in their native language versus their second language. TWB focuses on getting as much information as possible into people's first language. The decade-long conflict in northeast Nigeria has led to a massive humanitarian crisis, leaving about 1.6 million persons affected and over 2 million displaced. In northeast Nigeria, humanitarian organizations are working to support over 2 million internally displaced people and the communities hosting them. The language is a challenge. In this linguistically diverse part of the world, people forced from their homes don't always speak the same language as the people around them. International aid organizations may lack the skills to communicate with everyone in their own mother tongue. They often also lack information about the language and communication needs of affected people. Following an assessment in July 2017, TWB has deployed a crisis response team to support humanitarian organizations and other service providers to effectively communicate in a wider range of local languages. A June 2018 comprehension study by TWB Northeast Nigeria demonstrates the impact of format on the effectiveness of humanitarian communication. A communication strategy chiefly reliant on Rittenhouse and Kanuri will be ineffective. Two-thirds of women below the age of 45 did not understand simple written text in Hausa or Kanuri. Findings also show that due to gender disparity in literacy rates, there should be verbal and audio communication options. The use of pictures and plain language can help internally displaced people, and women in particular, obtain information that allows them to access services and assert their rights. TWB has been working in Nigeria since the end of 2017, and our research shows that 31% of households speak Hausa, 29% households speak Kanuri, which means that 40% of people who do not speak these two languages are excluded from receiving information, communicating their needs to access services, and benefit from confidential counseling. It also means that the most vulnerable groups, children, elderly, women, and illiterate people, are the ones who suffer from the information gap the most. For example, only 9% of uneducated female minority language speakers understood basic protection-related messages in a study at 5 sites in Maiduguri. TWB's mission is to bridge this gap, and we do it by providing the information in a language and format people understand. That means we translate the information given by other organizations in non-local languages, record it in an audio format, offer pictorial design, and training on interpreting, translation, and language awareness. In Nigeria, TWB has supported around 40 organizations to translate nearly 3,000 pieces of content, 2 million words, produced 300 pieces of audio, and designed 250 visual materials.
COVID-19 has triggered a global response to governments, aid agencies, and health workers. The pandemic is fueled by what the WHO calls an infodemic. People aren't getting enough reliable, accurate, and timely information that they can understand and use to best protect themselves. Everyone needs reliable COVID-19 information in a language and a format that they understand. Responders need to be able to listen to people to understand their needs, no matter what languages they speak. We are using our expertise in multilingual communication to address these urgent challenges through translations. TWB Glossary for COVID-19, language data, and mapping chatbots. In January 2020, TWB began working with the World Health Organization to translate key content related to COVID-19. Since then, thanks to the support of our community of over 30,000 linguists, TWB has rapidly expanded our language services and support for partners working on 5 continents. To guide that communication in Nigeria, TWB conducted a rapid focus group discussion with 11 linguists working in 8 languages that cover 83% of the crisis-affected households in Northeast Nigeria. The group discussed popular perceptions related to COVID-19 terminology in Northeast Nigerian languages. Language use doesn't distinguish between virus and disease. Most Nigerians have a good understanding of the medical concept of a virus and viral infections. This is due to previous disease outbreaks and sensitization campaigns around HIV/AIDS. When talking about viruses, speakers of most Nigerian languages usually use a generic term that means virus, bacteria, germs, or any disease-causing organism. Speakers of most Northeast Nigerian languages commonly refer to COVID-19 as corona or coronavirus. They understand the term COVID-19 as well, but as a more intellectual word used mostly in administrative communication. They use corona or coronavirus to refer to the virus as well as the disease. We can prevent confusion by referring to the virus using the terms most people will recognize. The spelling of corona and coronavirus varies by language. Most languages in Northeast Nigeria use a K to produce the sound of a hard C. Mandara speakers refer to COVID-19 as corona. Chibok speakers use the term coronavirus. Bura speakers say coronavirus or COVID-19. In Kanuri, coronavirus translates to coronavirus since there is no V in the Kanuri alphabet. In Hausa, COVID-19 is translated as cuta mai sarke numfashi, literally meaning disease that affects your breathing. This localized translation of COVID-19 was coined in the early days of the outbreak when the virus did not have a name. The symptoms of COVID-19 are generally understood, but there is confusion about the difference between it and other respiratory diseases like flu or asthma and how to distinguish between them. Some people consulted were unsure if a person with pneumonia would automatically get sick with COVID-19. Simple descriptive translations and explanations like disease that affect your breathing help people to better understand the impact of a disease and how it will affect them. While useful in clarifying confusing concepts, descriptive translations can make the distinction between one disease and another less clear. To address this confusion, people need detailed medical information in clear and accessible language to understand COVID-19 specifically. Explanations that lack detailed risk downplaying the severity of COVID-19 and can lead to misconceptions. People don't clearly understand the concept of social distancing. Many don't support the idea of keeping a distance, feeling it's not culturally acceptable. Places of worship are still well attended. Large family events like weddings still take place and people continue to shake hands. It is important to use contextualized translations of social distancing to ensure that the concept is conveyed correctly. Literal translations of social distancing create confusion. The more accurate term, physical distancing, can help people better understand how to protect themselves and others from COVID-19. In Hausa, people use Nisa da Juna for physical distancing, which literally translates as keeping away from each other. Another common Hausa translation is Tsayawa ko zama da rata tsakanin juna, which means standing or sitting with some distance between people. Margi speakers say Ndapudum Aranji, which translates as staying away from people. And in Shua Arabic, physical distancing is described as sitting with space between oneself and others. People need information, not just instructions. People understand basic information on the symptoms of COVID-19, hand washing, and keeping a physical distance. But they often lack the detail and practical guidance to understand, for example, why hand washing is important or how they can practice physical distancing in their daily lives. People need to know why and how they are supposed to follow protection measures. Clear, accurate, and accessible information is critical for effective health messaging. Our Hausa linguists shared that in Hausa, there isn't a word for face mask, and thus it's difficult to translate, and they need to explain the term to get the actual meaning across. Our linguists in Fulfulde share that the word alcohol in the local language is the same as saying beer, which makes translating alcohol-based hand rub really quite challenging so that people understand the difference between the alcohol beverages people consume and the substance contained in the hand rub. There are additional cultural factors to bear in mind when translating this term, as many Fulani people frown upon alcohol and do not associate it with something positive. Thus, Translators Without Borders has created a COVID-19 specific terminology database covering key terms and their counterparts in 42 different languages. This helps both translators, interpreters, and healthcare professionals as a reference point when engaging with communities on COVID-19. Appropriate translation for terminology is extremely important for ensuring that the community understands the message accurately. In addition to COVID-19, our glossary currently has areas on the themes of CCCM, MHPSS, protection, housing, land, property, grief, AAP, COVID-19. They have been developed in collaboration with technical specialists and language partners in Maiduguri for use across humanitarian response. Communication has the power to aid or hinder humanitarian efforts when responding to a crisis. A June 2018 comprehension study by Translators Without Borders in Northeast Nigeria demonstrates the impact of format on the effectiveness of humanitarian communication. The findings show that for pregnant and breastfeeding women, humanitarian programs should include verbal and audio communication options. The use of pictures and plain language can help internally displaced people obtain information that allows them to access services and assert their rights. Comprehension rates by format. 31% of respondents correctly answered a question about the key message when it was provided in text format. When a picture conveying a simple message was provided on its own, over half, 53% of the women understood the key message. Clear, simple, pictorial messaging appears to be more effective than text alone. 31% of the women correctly answered a question about the key message when it was provided in text format. That figure increased to 46% when a picture supported the text. It increased further to 53% when the key message was represented by a picture alone without any text. Picture comprehension levels were higher than text-only comprehension levels across all age groups and education levels. Research shows that audio is the most widely understood communication format among internally displaced people in Northeast Nigeria. Nearly 65% of the internally displaced population in Borno prefer to receive information by radio, according to IOM's DTM data. Humanitarians are responding to that preference by expanding radio programming, but patchy coverage and language diversity make that challenging. This report explores those challenges and suggests localized audio communication offers a more effective way to expand reach. Examples: we worked with UNFPA on PSEA audio training podcast series. Those 4 episodes are targeting frontline responders during the COVID-19 response. Instead of conducting training and doing training slides, the audio files are friendly to be shared through mediums such as WhatsApp. We have completed the episodes in Kanuri, Fulfulde, Shua Arabic, Margi, Burapabr, Waha, Kibaku, Mandara, and Hausa. Chatbot is an artificial intelligence that is used to have conversation via text or speech. Translators Without Borders is bringing a new innovation in the form of chatbot to Northeast Nigeria to improve the communication gap and create awareness, especially with unfavorable conditions of social distancing, lockdowns, and denying of information to minority groups and women. The chatbot is called Shehu, as it is driven from the local community of the region, because Shehu is one friendly person who is not a doctor, but everybody from women to men, girls to boys, young, old, and people with disability can easily talk to for information on everything. Shehu is the user-friendly bot created in 4 languages, namely English, Hausa, Kanuri, and Shua Arabic. Shehu will give information on COVID-19 alone for now. The bot can easily be accessed through WhatsApp and Telegram. It will be launched to the public by the end of January 2021. As this is a new bot, there are more chances that it will be improved to give information, not only on COVID-19 issues, but on other related health matters.
Translators Without Borders is working towards a world where knowledge knows no language barriers. If we don't build the tools to reach the speakers of minority languages, they will continue to be left behind. It's time to act. We need your help. Your contribution is critical to reach our goal. And not only your contribution will help us reach our goal, it will inspire others to give in turn. Are you in? Here in this quote, this man from rural Borno State in northeast Nigeria dropped out of primary school in 1998. We showed him some information to measure comprehension of content in various languages and formats. He spent a few minutes methodically working his way through the short Kanuri text. With a smile on his face, he turned to us and said, "It's been 20 years since I last read something in Kanuri. It's like I recovered a portion of my brain today. It feels great to read something in my own language." Thank you very much. This is the end of our presentation. We will share a link to Translators Without Borders website, our glossaries, and also a link where you can join our translators community online.